Welcome to Measuring 103. This session will show you the proper way to fit a patient for a compression glove or gauntlet. Juzo offers two garments for hand compression, a gauntlet and a glove with finger stubs. In the next few minutes, you'll learn how to determine whether the patient can wear one of Juzo's standard sizes or if a custom garment will be required. At the end of this program, you'll see a brief survey about our e-learning series. We encourage you to take a moment to complete it. Your feedback will help us fine-tune the series to your needs. Let's get started. When taking measurements, it's important that the edema is at its most reduced state, usually first thing in the morning or at the end of treatment. Make sure you have your Juzo measuring tape, washable marker, and size chart handy. Juzo gloves and gauntlets come in 6 standard sizes. To determine whether a patient can wear a Juzo standard size garment, compare the points you measure to the Juzo size chart. Standard sizing is determined using point A and point C plus fingers. Always measure the circumference first. Mark each point with the washable marker. We'll use these points later to measure length. Take these measurements in centimeters, measuring to the nearest millimeter for greater accuracy. The mark should be made on the correct side of the tape. What is the correct side? The side that is located near the point being measured. There are 4 circumference measuring points around the hand and 2 circumference points on each finger. Start with hand circumference point A, found across the base of the 5th metacarpal and runs perpendicular to the fingers. Next, measure circumference point B, at the base of the thumb, starting inside the thumb web and running parallel to point A. Point C is the smallest circumference around the wrist. C1 is usually taken 6 centimeters up the arm from point C. However, if the patient will need a shorter or longer wrist extension, just cross out 6 on the form and write in the correct length and take the circumference at that point. The finger circumference points are taken at the base of each finger, at point X, and where the end of the finger stub is desired, at point Z. Pre-mark the X and Z points. The X points are found at the base of the finger, and Z points where you want the glove to end for open finger glove. For point X, make sure both sides of the tape measure touch the mark. You may need to angle the tape measure a little to get the measurement. For point Z, never place the point on the crease of the finger. If the glove finger ends at the crease, the patient may experience discomfort when wearing the glove. Now, take the length measurement using the circumference points we just marked. First, points A to B. Then, points A to C. And last, X to Z. For a closed finger glove, take the additional circumference measurement at the base of the fingernail, point Z. Measure from point X to the end of fingertip on each finger for the length. Finally, make sure you check the appropriate boxes on your Juzo custom glove or gauntlet form, such as whether a closed finger glove is needed or whether or not the glove will be worn with an arm sleeve. As you can see, it's quick and easy to take a patient's measurements. Here are a few tips to remember. Always have your Juzo measuring tape, washable marker, and size chart handy. When measuring for circumference, mark the point with washable marker so it's easier to take the length measurements. Never take a distal circumference measurement in the crease of the finger for the most comfortable fit. And make sure your Juzo custom form is filled out completely. We hope you've enjoyed Measuring 103, how to fit a patient for a Juzo glove. You can test yourself on what you've learned by taking our e-learning quiz, or you can return to the main menu to start another e-learning session. To download our size chart and measurement forms, visit the Juzo Dealer Toolbox. Thanks for watching.